The SDGs, or Sustainable Development Goals, are a set of 17 global goals adopted by the United Nations in 2015. These goals were established to address the interconnected challenges and opportunities facing the world, including poverty, inequality, climate change, environmental degradation, peace, and justice. The SDGs build upon the Millennium Development Goals, MDGs, and provide a comprehensive framework for development and sustainability. They encompass a wide range of social, economic, and environmental issues, aiming to create a more equitable, inclusive, and sustainable future for all. The goals cover a broad spectrum of areas, including ending poverty and hunger, ensuring quality education and healthcare, promoting gender equality, sustaining resilient infrastructure, combating climate change, and fostering sustainable cities and communities, among others. The government of the Kingdom of Saudi Arabia, represented by the Ministry of Health, seeks to launch several health initiatives in relation to the National Transformation Program 2020 and the Kingdom's Vision 2030, and this comes within a series of initiatives amounting to more than 40 initiatives. In recent years, the Ministry of Health has achieved achievements for its goals, including achievements for its sectors and services. At the primary healthcare level, more than 80 healthcare centers have been opened throughout the Kingdom of Saudi Arabia. Among the services it provided to more than 52 million patients are primary healthcare services, immunizations, dealing with chronic diseases, and maternal and child care. It is one of the most prominent initiatives of the Kingdom of Saudi Arabia to support and achieve the third goal of the Sustainable Development Goals. 1. The new National Path of Healthcare Services for Pregnant Women. 2. The National Drug Prevention Project, called the NEBRAS Program. 3. Educational programs to promote traffic peace, called the Wellness Program. 4. Implementation of 36 new hospitals, 2 medical cities, with a clinical capacity of 11,300 beds. Determination of sustainability, ensuring healthy lives and promoting well-being for all at all ages is the third goal of the 2030 Agenda for Sustainable Development. The associated targets are to lower the global maternal mortality ratio, stop newborn and child deaths that could have been prevented, stop the spread of infectious diseases like AIDS, tuberculosis, and malaria, lower mortality from non-communicable diseases, improve substance abuse prevention and others. We chose it since a robust and healthy human population is necessary to create a sustainable world and to achieve economic, environmental, and social goals. This graph shows the SDG progress in the Kingdom of Saudi Arabia. We can notice that more than half is achieved. Also, we can see as well that a large number of the common troubles related to health and well-being are in the progress to be achieved, such as child mortality by 16.2, traffic deaths 18.5, universal health coverage by 74 and subjective well-being by 6.4, which is a good indicator. The graph above shows the SDG process globally. We can see that a large number of common troubles related to the health and well-being are on progress to achieve the target of the goal, such as child mortality, mental health, tobacco control and road accidents, which we can consider that it is a very good signs. Focusing on environmental pollution and trying to reduce it would make our way easier towards achieving our goal, because with less pollution, we will face fewer health problems. Moreover, lack of knowledge and awareness regarding their health leads to increased mortality rate, aggravation of diseases, etc. Finally, people live near industrial areas, which increases the risk of cancer and diseases, as well as parents not feeding their children nutritious foods, which sometimes results in children's weak immunity continuing into adulthood. All the previous problems would hinder any country from moving forward with its development plan, because health and well-being are the most important goals. One of the Kingdom's action was planning the Global Health Exhibition in 2023 that has more than 300 companies represented as well as more than 100 speakers plus 29 countries has participated in it. As well as the recently published national insurance that has no limits and will be funded by the government. In addition, it will be throughout the individual's life and it does not need annual renewal. The main purpose of it is to ensure the protection before the medical need of the Saudi citizens. 1. Increase access to quality healthcare services for all Saudis. This could be done by expanding the public healthcare system, providing subsidies for private healthcare, and building more hospitals and clinics in underserved areas. To promote healthy lifestyles and behaviors through education and awareness campaigns. This could involve teaching children about healthy eating and exercise, and providing adults with information on how to reduce their risk of chronic diseases. 3. Strengthen the healthcare system by training more healthcare professionals and building new hospitals and clinics. This would help to ensure that all Saudis have access to quality care, regardless of their income or location. The Health Sector Transformation Program. This program is aimed at transforming the healthcare system to be more comprehensive, effective, and integrated. It focuses on improving access to healthcare, modernizing facilities and equipment, and enhancing the role of private sector investment. The Vision 2030 Realization Program. This program includes a number of initiatives to improve the quality of life for Saudi citizens, including initiatives to promote healthy living and improve access to healthcare. I believe that these initiatives will help Saudi Arabia to achieve the target of good health and well-being for all by 2030. However, it is important to note that this will require a sustained effort from the government, the private sector, and the public. In light of the global crisis COVID-19, the Kingdom of Saudi Arabia has proven that it has a high skill in managing crises and covering health needs, and the pandemic was the biggest challenge facing the field of health. However, COVID-19 was a challenge, but it was more of a motivation and starting point, and it was represented in several axes, including infrastructure and logistical support, which relied on using the largest possible number of health resources, whether facilities or workforce, for both the public and private sectors. Data and technology. The kingdom has collected the largest health database of patient data, quantities of medicines and available health facilities, and linked it to the government website Abshir. Health and prevention. Working on the quality of health and prevention and the extent of its activation and monitoring. The individual and society. Raising awareness among the individual and society and increasing communication channels to reach a larger number of society.